We're for sharing innovative treatments and preventing disease before it ever develops. Learn how our team is working to better care for you on this edition of UVA Health System Radio. Here's Melanie Cole.
A new palliative care service at UVA CareTrack is helping patients with heart failure and advanced cancer better manage their pain and symptoms. My guest today is Dr. Leslie Blackhall. She's a board-certified specialist in palliative medicine, helping patients manage pain and symptoms caused by serious conditions or intensive treatments. Welcome to the show, Dr. Blackhall. I'd like to start by having you explain the difference between palliative care and hospice care. People hear palliative and they think end-of-life care.
Thanks so much for having me on, and I'm delighted to be able to talk to you about this. You know, I've been working at UVA with palliative care since 2001, and since that time, we've been there in the Cancer Center, now the Emily Kirk Clinical Cancer Center. And our job there is to help people with cancer in that setting at any stage of their illness, including people who are cured of their cancer but still have problems. You know, sometimes even after you've finished your treatment, you'll have ongoing symptoms like pain or nerve damage in your feet, fatigue, or mood problems that are related to the cancer or the treatment of the cancer. So for palliative care, our job is to help people with those kinds of symptoms. That's whether they're caused by a cancer that's now cured or a cancer that's undergoing curative therapy or a cancer that's undergoing treatment, the purpose of which is to prolong life but is unlikely to completely cure the cancer. So really, the difference is that hospice care is done for people who are terminally ill, expected to not live for 6 months, and they have their symptoms taken care of. But I think for when we're in palliative care, folks like me felt like that type of care, why should it only be reserved for patients who are likely to die of their cancer? Why can't all of us who have those kinds of serious illnesses get that kind of treatment that's, really directed at improving quality of life, and by that I mean function, ability to lead a normal life while you're undergoing these treatments.
Do you still see your regular internist or oncologist or cardiologist while you're involved in palliative care?
Absolutely. I mean, one of the things that I've really loved about working in the Cancer Center and now with the cardiologist is the ability to work as part of a team. You know, if you're undergoing chemotherapy, if you're getting treated for a serious heart condition, you want your oncologist or your cardiologist to be focused on treating that underlying illness. But there needs to also be somebody whose focus is treating things that are either side effects of the treatment, such as chemotherapy-related nausea or fatigue or other side effects of treatment, and you need so you need both of those. It's really a team effort with an illness as serious as this, and this is something I think we've known about for oncology for a long time, but really it's a real breakthrough to think about cardiology in the same way. I think as we have treatments that may not completely cure an illness but prolong people's lives for a long time, we have to be really aware of how much we want that life to be one that's as normal as possible, so people can continue to live in a normal and to enjoy every moment.
I understand that UVA now offers a program called CareTrack. How does it work? Tell us a little bit about it.
Sure. I think one of the things, many years ago, maybe 20 years ago, I was at something called the Cancer Pain Initiative that was a nationwide effort to improve the care of people with cancer and to improve their pain control specifically, which can be very difficult. And I remember commenting to one of the people at this meeting is that we would probably pay more attention to pain if we had like a blood test that told people what your pain level was, because those are the sort of documentation that doctors tend to pay attention to. And the CareTrack program actually came out of that sort of idea that, if you look in someone's medical chart, what you see is, what their blood counts are, what their kidney function is, a lot of numbers related to their care. But there's really, until the Care Track program, we didn't really have a good way to keep track in the same visible way of how the patient is feeling, their ability to get up and around, their ability to function due to pain, their fatigue, their shortness of breath. And so in 2012, Dr. Paul Reed and myself, along with our colleagues Jim Harrison and George Stukenberg, got a large national grant to develop a program that would track patients' symptoms using a specific type of questionnaire that's built into the medical record, so that every time the patient comes, they answer these sets of questions, and there's a trigger that goes off in the electronic medical record for people who are starting to struggle. Are they getting so fatigued that they're having trouble getting up and out of bed? Are they having so much pain that they find it difficult to interact? Are they incredibly anxious? And when that trigger goes off, it alerts a whole group of supportive care specialists, physicians, social workers, and dietitians and folks like that to help come in and deal with those symptoms in the same emergent way you would have if somebody's white blood cell count went way down or their kidney function became threatened. And so Care Track stands for Comprehensive Assessment with Rapid Evaluation and Treatment. So meaning we don't wait until someone is so ill that they end up in the hospital. We try to get to them as quickly as we can prior to that point and support their those types of symptoms, because what we do know is that those things that tend to make people end up in the emergency room. And our program has shown a lot of success at the Cancer Center in keeping people out of the hospital and in getting them to feel better. And so we have now extended that into another group of patients, which is people with advanced heart failure.
So that was going to be my next question. Which patients is Care Track designed to help?
So it started off for people with very advanced cancers, and that's from 2012 until this July. Those are the folks that we reached. And then starting in July, we got another award called the Buchanan Award at University of Virginia because of the success of this program to extend it into cardiology. So there's an advanced heart failure clinic at University of Virginia with Dr. James Bergen and Jamie Kennedy, and they expressed interest in having this type of program to help support the seriously ill people in their unit who also suffer from pain, problems with functioning, getting up and about, and the fatigue and other, very short of breath often. And so we're developing for the heart failure clinic a similar group of palliative and supportive care specialists who will be there to help support those patients and have their symptoms taken seriously as we work side by side with our cardiology colleagues as well.
What a wonderful program. I certainly applaud your work. In just the last few minutes, Dr. Blackhall, please give the listeners your best advice, what you want them to know about pain management, palliative care, and the Care Track program that you've developed, and why patients should come to UVA for their palliative care.
Yeah, I think it's important that people know that palliative care is about taking good care of people. Studies have shown that patients with cancer who are followed in a coordinated way by palliative care specialists and oncologists not only feel better, they actually live longer. And because part of taking excellent care of patients is taking care of the whole patient, not just the tumor, but all of them. And similarly, I think people with a serious illness like heart failure need that same type of team-based coordinated care. There are not that many places that have dedicated so many resources to helping our patients in this way. And I want to say I just feel incredibly grateful to be working at an institution that's had the foresight to allow us to develop this sort of coordinated care program where there's a team-based approach to help all patients feel their best no matter how seriously ill they are.
Thank you so much for such great information. You're listening to UVA Health Systems Radio. And for more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole, and thanks so much for listening.